Good afternoon and welcome to today's webinar, What's New in Healthcare Leadership Technology. Before we begin, I wanted to let everyone know you're automatically muted, but if you have any questions, you can type them into the question box and we can get you an answer once the presentation is complete. If we don't get to every question, we'll email you the answer afterwards. And this is recorded. My name is Tom DeSantis from Laudio. We're healthcare's first transformational leadership platform. And in looking at our audience, I can see most of you know us and have an understanding of what we do. So to avoid repetition, we're going to dive into technology, our technology framed by some new research we're conducting that has not been published yet. So for our agenda, we'll once again look at the problem of retention. We'll talk about the research we're doing on the HR side of the house, and we'll share the top 3 findings. This should take less than 30 minutes of your day. Again, I thank you for joining us. Let's start with this graph. It's from our retention study where we aggregated turnover data from 12 hospitals, looking at over 11,000 nurses. Keep in mind, these were forward-thinking facilities with retention initiatives and various programs already in place and emerging. And while they are below the 17% national average, you can see there's still plenty of work to be done. And why is this important? Why are people trying to solve turnover? Why are healthcare leaders engaged with Laudio in the first place? It directly impacts the bottom line. Look at what it costs to lose 1 FTE. Here we've calculated $65,000, and then see how that annual cost adds up to millions of dollars. Here, 13 million. I know your assumptions can differ from these national figures, but arguably your system is dealing with a significant cost associated with churn. We know there are many reasons why healthcare in particular is dealing with the turnover issue, and our research identified one, the frontline manager. We know with budget strains, mergers, and consolidations, managers are responsible for more and more staff. One study we did showed up to 200 direct reports in a nursing unit, for example. Couple that with another data point that nearly 80% of the frontline managers we researched had no management training. Here in this chart, this shows a correlation between the larger spans of control and the higher turnover rates. So that begs the question, how can we help the frontline managers? Well, that's why we built Laudio and used artificial intelligence and advanced analytics to support frontline leaders. I know for some of you, this is a reminder of how the platform works, but here's a visual that explains how we aggregate the data, we analyze and predict turnover risk, then we push prioritize recommendations for each action, we automate the process for personalizing that action, and as a result, Laudio increases the ability to communicate and manage teams at a rate and frequency that could not have been done before. And more importantly, this engagement represents meaningful interactions based on data-driven, evidence-based benchmarks. If you've seen a demo of Laudio, you know what I'm talking about. And if you haven't, I've asked Tom Hills, our SVP, to join us today with a different lens on the issue we're solving. Welcome, Tom.
Hey, thanks, Tom. Glad to be here this afternoon.
Tom, you've especially been in the field working with health systems. And what we thought was just a nurse leaders issue is actually a challenge shared with human resources. Why don't you tell us what we've been at this summer?
Yeah, it's great. Thanks, Tom. One of the things that was so interesting as we've been working to gather more feedback on the Laudio platform, we found that it easily extends beyond the world of nursing leadership into leadership across the entire system. And because of that, we've been spending a lot of time with HR leaders, especially CHROs in a number of different very large healthcare systems, to gather their feedback and to understand what trends are most important to them. And Tom's now, I'm going to pass it back to him. He's going to talk a little bit about the trends. And then what I'm going to do is to be able to point to the platform itself and how we are supporting some of those insights on the HR side. Tom?
Thank you. In no particular order, our first theme that came out of the interviews with the CHROs is about implementing advanced HR tools to drive process improvement. So what I heard, and Tom, you may have heard this too, HR was so, their charge was backfilling and recruitment and making sure they had a pipeline. And for them, it was a natural occurrence that people were going to be leaving the organization. And there was nothing they could do about it. And I think that changed. And that is changing amongst especially large institutions with so many positions to fill. That there are changeable factors within the health system that can be modified or influenced to help people stay. Look at some of these quotes, and these kind of touch upon some of those changeable factors. Healthcare employees are brilliant in their professions, but they may not know how to manage people. I talked about how those nurse managers, 80% of them weren't trained to be managers. They were trained to be nurses. And other issues were, 2,000 staff and supervisory positions. That was out of a health system, I think, that had 5,500 employees. So it's a good chunk of folks.
Well, one
Tom,
of the other things, just to build off of what you just said, Tom, too, is as we were talking with HR leaders, they were remarking about their own systems and tools that are available and where some of the shortfalls lie. First, we know that there are already large systems like time and attendance systems and HRIS systems that are supporting the HR effort. But what we learned from these HR professionals is that those are largely databases that do a great job of being able to sort and compartmentalize information, but they rely on folks to find information within them and are not necessarily integrated with each other. What we learned too is that there are many activities that a frontline manager must do that are not supported by any systems. That can be celebrating and recognizing staff. It might be recognizing signs of burnout early, or personalization that's needed in terms of feedback or rounding. What we've found is a great support. We started learning this on the nursing side as we were talking with nurse leaders. We're finding that these same shortcomings apply regardless across the entire health system. And based on that, then I wanted to show a couple of things that we've really been working on within the Laudio platform to be able to address these specific needs. So here I've logged into the Laudio platform, and I want to highlight two things that are correlated with what we just discussed in terms of the learnings from HR leaders. The first thing is the role that technology can play in helping reduce the variability that managers may demonstrate in interacting with their teams. That's really associated with the way Laudio can bring templates to the managers so that they can have a starting point in reaching out to their teams or having conversations with individual employees. The second tool is our ability to be able to use data to actually profile the turnover likelihood of individuals on a particular team. So let's talk first about templates. You can see here I've logged onto the Laudio platform. I'm on my home page here as Marguerite, so I'm Marguerite, the nurse manager here in this case. I'm looking at different observations that Laudio is bringing to my attention, and I can act on these observations. In this case here, you can see Ashley's picked up an extra shift 10 times this past month, something I might not have known on my own. And in this case too, I noticed that she is not here working. If she were working, Laudio would tell me by giving me this little green dot here in terms of her being on the floor now. We're taking that from clock in, clock out data from the time and attendance system. In this case though, I want to recognize her just through a message, and I can either email her or I can send her a text. But notice here that automatically for me, Laudio has built a template that I can start with. So I don't have to spend time thinking about what I'm going to say. Laudio is telling me what I might choose to say. And it's actually provided my name here, Marguerite, at the bottom of the message. So just in a matter of a couple of clicks, I could customize this, or I can accept it for what it is. I can log this, and that's going to now show up in her profile, her virtual profile. But more importantly, I'm connected directly to Outlook, and I can send that and it can be on its way. Notice that the message can be different too, depending upon what it's about, what the observation is about. In this case, it's an accountability observation where Anastasia has missed a punch. I can send a message again here. Notice here, hi Anastasia, I've noticed that you've had a few missed punches this past month. Let me know if there's something we can do together to help adjust. If this were a more severe accountability related matter, where I might want to have some consistent language that's associated with union contracting or HR policy, Laudio is pre-built with that information in it, and it doesn't take me time to look up how I should frame that conversation. It's put together for me, and I can send it on its way. Let's turn now to the second of the two pieces beyond templates. Let's talk a little bit more about another HR advanced tool that's not typically available in other systems, and that is predicted turnover risk. So you can see here I've got a list of my entire team. I've been able to sort the team by predicted turnover risk. What Laudio is doing is taking data associated with underlying correlations with behavior and structural components, like whether someone is a millennial or has recently joined the organization, and being able to use that data to identify specific turnover risk profiles, high, medium, and low, per person on my team. Notice here that Jacoby has less than 18 months tenure here, is a Gen Xer, and he's not taken a vacation in his first year in working with us. So this is an insight that I might not have had without Laudio, but in this instance now I can begin to take action and do it smartly to be able to rescue Jacoby before he might want to leave the organization. So I'll turn it back to Tom now for the second observation that we've had, or category.
So the second theme, operationalizing best practices to empower frontline leadership. So yes, the advanced analytics and the advanced tools for HR are emerging, but one of the things that we're finding, especially with these quotes, at our system, 70% of the time, managers who are more active communicating with their teams have higher engagement scores. We're looking at outcomes. Our CEO has made me responsible for labor productivity. So this is something that HR is getting more involved with, to see who's performing and not performing and what they can do about that. And that actually brings them closer to the care delivery. And one of the things that's becoming a priority is frontline manager competency. HR is starting to look at that and figuring out, how do we develop leaders and how do we do it consistently? So one of the things we know from the HR perspective, they're very much on top of and charged with compliance. They're very much in charge of training people for clinical upgrades and clinical improvements and innovation. What's happening is there's now a need to do that on the management side. So we've all, in healthcare, we've all heard about standardization. We've all heard about reducing variation. Tom just touched upon that. And now with this type of platform, everyone is touching the same type of information and acting upon the information in a similar way. So
what's interesting about that, Tom, is you get what you measure, right? And so one of the most difficult things for senior leaders is to be able to know whether or not the leaders that they're leading are having the appropriate number of interactions with their teams. Are they stuck in meetings all the time, or do they prefer being in their offices rather than having conversations directly to be able to better coach and manage their teams? Again, we're making some real strides on the platform in this area. Now, some of you who are familiar with the Laudio platform know that's already built in is an ability to be able to track by manager the number of interactions that I may be having with my team. We're building this up over time just as a natural part of interacting on Laudio. So for instance, you can see here for Marissa Gardner, as part of Marguerite's team here, I just roll over here, I can see that I've had 3 opportunities to recognize her, 8 different accountability issues that I've discussed with her, and I've had 1 observation about her exhibiting signs of burnout, similar to what I showed you before with Jacoby, that I've addressed. Now, I can ask myself here with Adeline, this is the number of actions that have occurred over the last rolling 365-day period. With Adeline, I've had no interactions with her at all. But notice that she's had no disciplinary activity with me either. So she's probably one of these solid 80% of the core people who come in and do their jobs every day and just leave. Why am I not interacting with her more frequently? Now, what we're doing right now on the platform, and we'll be deploying here within the next couple of months, is making this activity tracker smarter. So based on the turnover risk profile that I had talked about before, and then also combining that with activity levels, we can get smarter about each of the different people on my team. In this case, I can see Mike Smith is listed here. And what Laudio is showing me is this number 0/3. What that means is that I've had no interactions with him over the last rolling 90-day period. But Laudio is telling me, based on his profile and what behavior Laudio is seeing he is exhibiting, that I should actually be interacting with him 3 times. Shyla here, you can see I've actually interacted with her 1 out of the 3 times that Laudio is recommending. Some of the other ones you can see down below. Elnora here, Laudio had suggested I interact with her 3 times, and I've interacted with her 3 times. So what you can see here now is we can dial up and dial down the number of interactions that someone needs based on both what we're seeing in the data and what we're seeing associated with engagement scores and their personal needs. So I'll turn that back now to Tom for the 3rd insight.
Thanks. So the 3rd theme that we pulled was providing real-time feedback for proactive managing and coaching. And what's interesting, Tom, you just talked about engagement scores, and you know, it's important to the nursing leaders, but it's really important to the HR folks too. And they're the ones that are getting, I don't know if the word's overburdened, but with surveys. And that's happening a lot. And we know there's a lot of tools out there, and every system is implementing their own. And what happens with that a lot of times is the timing, and when you randomize it, are you actually talking to the right people? And are you aggregating it? And is it a delay in when you get the results? So all of that is an issue that folks are dealing with, especially from the HR side. These are some quotes that people talked about. We need to be assessing on a regular basis to see what's working and not working, more frequent assessments of engagement. We spend too much time on surveying and not enough time listening. This was an interesting quote too that resonated with a lot of us on the call. With the delay in survey management, we're chasing ghosts. So this is the whole antithesis of being real time. And we need to be moving forward towards predictive analytics in HR. And I think that's what this helps people do. And people were telling stories from the field. And one of them talked about an emergency department leader. I'm not sure what their role was, if it were a manager or a director, but they were new to the role. And coincidentally, they were doing a pulse check, whatever their survey tool was, instrument was. And it happened, I think, 3 weeks after that person started. And they were finding from the pulse check that the people that reported to this person, there was communication issues, and they were complaining about it. And HR was actually able to go in with that individualized feedback and address it. And it didn't become it got nipped in the bud. What this HR person said to me is, you know, it was serendipity that the pulse check was right after that happened. What if it were their usual annual survey, and that problem had escalated over a year? Wouldn't it be, I'm trying to look at my notes here to see the question he asked. Wouldn't it be great to have a continuous feedback and communication tool between managers and their staff? And of course, Tom, I knew the answer to that one.
Well, it's really interesting. I think the biggest gap that is aligned with this real-time feedback theme is in the performance management process. So many of the systems that we talk to have an annual review process in place, and they would like it to be more frequent, but it's impossible when one manager is trying to provide feedback across 200 people who are reporting to them using traditional methods. So let's turn to the platform again and talk a little bit more about how Laudio is supporting more and more real-time interactions with teams. So I'm here back on the platform again, and I had pointed something out already previously, but I want to emphasize it again. See how with Laudio's top recommendations, I can simply sort who is on the floor now. So what are the recommendations that I can interact with somebody in person about? It could be both birthdays, it could be anniversaries. Note here that there are 2 new team members on my unit that have upcoming check-ins. So I can see here that they're on the floor now. Laudio can support that conversation by providing some suggestions in terms of what the check-in questions should be. One of the other things about real-time feedback is it needs to be documented easily. So once I've had the conversations, so now I don't need to worry about searching to find somebody to see if they're on the floor. I know they're on the floor. I have the conversation with them. then all I simply need to do is access Laudio, identify the fact that I want to add a note for both of these employees. I can simply hit continue here and notice that the questions that we were already prompted to ask are already embedded within the framework of the note that I'm going to take. So I can certainly indicate what my response may be here and do that question by question. I can do this on a mobile device actually immediately after the conversation I have, or maybe I'm going to go ahead and do it in my office after Scarlett, for instance, has left. Ideally, though, too, is that with every conversation, I'm learning something new. I may want to remind myself to follow up with that person after a certain period of time has expired. Let's say after 2 weeks has expired, and Laudio will then notify me when the team member is on the floor after that time frame has expired. So now I don't need to have any additional tools to be able to make sure that I follow up, and I can simply click and add a note right there. So it's as easy as that to be able to do that. One other important thing too is as I prepare for annual reviews or hopefully quarterly reviews with anyone that's on the platform, I can get a virtual performance outline of everything that has happened between this employee, me, or other people that are supporting the leadership activities within this team. So now, rather than going into Outlook and trying to sort and find different interactions, print those out, try to create a binder. All I have to do here is look for Marissa, and I can see what is her turnover risk, what specific information that is unique to her I need to consider. What kind of professional engagement has she had? What teams does she belong to? What does her time and attendance look like? What is her mandatory status? Is everything up to date? Have there been any disciplinary actions here? No. So I can see not only what kinds of information would make it better to coach her, but I also have information at my fingertips to know whether or not she's ready to take another step, for instance, another committee assignment, or what that assignment might be. Note too that all this information is available should I leave my management position and someone take my spot. They can get this information at their fingertips without having to go through a lot of files to come up to speed. So I can, as the new manager, become much more effective more quickly. Likewise, if Marissa moves to another department, all this information will go to the new manager that she will report to. So with that, I'll go ahead and turn it back to Tom.
Thanks. I think there go the days of sticky notes, binders, spreadsheets. All of that is eliminated by this. But one of the things we want to say is that it's working. We've been able to show and correlate that with the number of increased engagements and meaningful engagements, there is an increase in staff satisfaction. And Tom, just talk about this study real quick.
Yeah. Actually, we were looking both at engagement and at turnover. And research would tell us on a small scale, if you look at teams of 8 or 10, that if there are more meaningful engagements between a manager and the team, that engagement scores will go up and the turnover will go down. You know, people don't quit a team, they quit their manager. But what we're seeing here is, and this is looking at a 500-bed hospital and looking at the pilot units that began the particular deployment here in terms of the percentage change in employee engagement survey scores pre and post the deployment of Laudio, how these scores go up. And I was, again, talking with somebody about a week ago about these results, and he said, by all measures, these are statistically significant for engagement score movements, which is exciting. And of course, with higher engagement, you should see lower turnover. And in fact, we're seeing that here in this particular site, where the initial cohort, when we deployed after a period of settling in, saw a significant decline. These are point changes. So 7.5 points were removed from their turnover during that quarter in 18 compared to the quarter a year ago. We know that turnover data can be can be seasonal. You can see also when the rest of the hospital rolled out, they saw fairly dramatic results across all units in terms of turnover reductions too. One thing, Tom, before we end the conversation here, I think just to summarize what you've seen here. One, CHROs and the HR community is directly aligned with the nursing community in terms of the need for better tools to help increase the number of meaningful interactions that the frontline manager has with their teams. The other thing that I think we'll conclude here with is that we're excited about the opportunity for Laudio to broaden its reach beyond nursing to the entire enterprise and bring value, bring greater sense of satisfaction, not just for the staff, but also for those frontline managers who clearly have the most difficult roles in the hospital.
Thanks, Tom. I have some questions. Are you ready for them?
Yeah, absolutely.
All right. The first one, if it is a shared goal between nursing and HR, who funds it? Obviously, it being the platform.
Yeah, I think this depends system by system, but what we are finding is that the CHROs, from a systems perspective, tend to buy systems perhaps more frequently than the nursing leaders do. The best situation in making a purchase decision are when the HR leadership is highly aligned with nursing leadership, where they act together as a team. They determine what their strategic priorities are jointly and are able to then invest in the technologies that are going to be able to have the greatest impact on the engagement of everyone in the facility or in the system.
Thank you. Second question. This is great in theory, but do managers actually use this?
Yeah, that's a great question as well. We all have experienced technology in healthcare that's rolled out with a lot of hoopla, a lot of excitement, and then no one uses it after a couple of months. One of the things that we're finding is that managers really have very few tools that are at their disposal to be able to provide an integrated way of managing their teams. Not only is the platform designed in a way that makes it easy to use, so the user interface has been deliberately designed by nurse managers for nurse managers so that it's easy to use. But importantly, what we're finding is that managers, as they begin, they might start with a top 10 list and work through that each week and then begin exploring in more depth what they might be able to do within each of the different workflows, whether it's celebration and recognition, accountability, a risk of burnout, or employee development. As they get feedback from their teams, it becomes then self-reinforcing in terms of more utilization. So I'll give you an example. One of the nurse managers told us that once she began using Laudio, one of the people on her staff said, you know, you're so much smarter now. Everyone on the team knows that that you're noticing things that you didn't notice before. Another example was where there was a time and attendance issue where the manager would have previously, without Laudio, thought it was due to significant performance problems, when in fact, when she had a conversation with the staff member, found out there were significant personal issues at play. And the staff member said, I'm so glad that you came to me because I didn't know how to have this discussion. And because you reached out to me first, it means you really care.
Tom, maybe I can add, I was trying to think of this answer too. In addition to the qualitative components you just discussed, how about some of the quantitative? For example, I know I read there was one nurse that attributed saving 6 hours a week in her administrative time.
Yeah, actually, we've got time in motion studies that we've done that have shown about that same kind of time savings, really, because we're automating what we would call administrivia. Many of the things that take a lot of time manually to complete, we're making that automated, simple, easy to do, so that the manager can now have more time focused on those meaningful interactions with each member of the team.
Yeah. And that keeps them coming back to the platform.
Absolutely.
All right, I have a third question here. Beyond turnover and engagement, are there other benefits?
Yes, there are benefits, and we're just beginning to figure out how to measure them. As we think about expanding the platform to more departments, there are also new data sources that we think we can bring into the platform itself, not just HRIS or time and attendance data. We've talked a little bit about credentialing. Learning management systems provide a great source of new data that should help us drive greater value. Patient acuity that can come into the platform, perhaps that comes from the electronic medical record. Even bed management information that can be gathered to be able to help us understand what length of stay might look like. Just imagine as the data sources increase that we can draw from, the new types of observations that we can bring to the attention of the manager so that they can in turn act upon them quickly.
So with that, I am going to sign us off. I'm going to thank you, Tom, for joining me today to go over the platform.
You're welcome.
We're going over some of the research. It's exciting. We probably will be in the fall publishing this a little bit more formally, and we'll make that available to folks. And for all of you that joined us, we appreciate your time, and we hope to hear from you soon.